Hello, everyone out there. This is the Resolv Healthcare podcast with me, your host, Israel Bautista. Today's episode, 4 Credentialing Best Practices to Improve Healthcare Collections, was written by Veronica Enns, Resolv Healthcare Credentialing Manager. 4 Credentialing Best Practices to Improve Healthcare Collections. The credentialing provider enrollment process can be complex and time-consuming, but it plays an essential role in practice reimbursement. Provider credentialing lapses and errors can significantly impact healthcare practice revenue. More specifically, when details are missed in provider enrollment credentialing with network payers, claims may be denied by insurance companies, which results in delayed or lost revenue. Reducing claim denials is more important than ever, as denials rose to 11% of all claims last year, up from 8% in 2021, according to the recent Crow RCA benchmarking analysis report. That translates to 110,000 unpaid claims per year for an average-sized health system. Across our client partners, we find when healthcare organizations take steps to minimize credentialing errors, we see a 1 to 5% revenue lift due to reduced denials. The key to minimizing revenue loss from credentialing errors is a streamlined provider enrollment credentialing process that follows industry best practices. In today's episode, we're going to discuss credentialing key roles in healthcare reimbursement and tips to improve healthcare collections by optimizing credentialing provider enrollment processes. Credentialing's crucial role in reimbursement. Credentialing provider enrollment is the process of registering healthcare providers with insurance companies, government programs, and other payers to ensure that they are eligible to receive reimbursement for the medical services they provide. It is critical for healthcare billing as it establishes provider credentials and authorizes them to submit claims for reimbursement. During this process, healthcare providers must complete various forms and provide documentation to verify their credentials, such as medical licenses, certifications, education, hospital affiliations, scope of practice, disciplinary actions, malpractice claims, other relevant information. Once the provider enrollment application is submitted and approved, the provider is often assigned a unique provider ID used to identify the provider with each network in their internal system. Claim submissions will include the provider's NPI, National Provider Identifier, and billing TIN, tax ID number, for the practice they are rendering services for. Managing the payer-provider enrollment process requires an internal and/or external team of credentialing specialists to work directly with each provider to prepare all required information to submit applications to the payers. On an ongoing basis, it is important to keep provider credentials up to date, as every payer network has a unique set of credentialing standards required for a provider to contract with their network. If credentials are incomplete or not kept current, practice revenue will suffer. Next, our top best practices for improving the provider credentialing process to boost practice revenue. Number 1, make sure you are in network with the correct insurance plans for your region and specialty. The more payers you are in network with for your local region and patient demographic, the better, as patients seek out in-network care. Additionally, being in network with providers can reduce your contractual fees and improve your collections, since it is easier to collect from payers than patients. Make sure you have a solid provider enrollment process in place to establish in-network contract agreements with all local and relevant payers. Be aware, if you move practice locations, your status does not roll over. If you move locations, go out on your own from a group practice, or add a new clinic, you must notify all payers. If you begin seeing patients at the new location without updating your credentials, you will not maintain in-network status and will lose out on in-network billing for patients seen during your lapse in status. Have your credentialing team maintain your practice demographics, phone, fax, mailing address, service locations, billing pay to address. This will help you avoid missing a recredentialing letter or not returning a data verification, which can lead to network termination. Number 2, dial-in processes for onboarding new providers. These are some of our top watch-outs for credentialing new providers. Following each payer's application instruction down to the smallest detail. Taking time to understand all requirements, licensures, hospital affiliations, scope of work, etc. will help prevent common credentialing denials. Even using an outdated version of an application could cause an application to fail, sending the practice provider back to the end of the line. Other common reasons for denials include credentialing a provider under the incorrect specialty taxonomy, not classifying a provider correctly as a primary care provider, PCP, versus a specialist, neglecting to revalidate Medicare, state Medicaid plans, or trying to bill for a managed care program with the provider that is not participating in their state Medicare program. Allow enough lead time for the enrollment process before a provider plans to see patients. The average turnaround time for most payers is 90 to 120 days after the application is submitted. Make sure you also leave enough lead time for malpractice professional liability coverage to allow enough time for your insurance carrier to issue a certificate of insurance, COI, well in advance of the provider's start date, as it will be required for credentialing purposes. Number 3, maintain. Initial provider enrollment is just the first hurdle in the process. The next step is to remain in network over time. Maintaining status is necessary because every payer requires that providers be retested, recredentialed regularly. The average network contract will have a term of 2 to 3 years, with recredentialing due before that period's end to determine that you are approved for another 2 to 3 year term. You are also required to complete quarterly attestation either through your Council for Affordable Quality Healthcare CAQH profile, a validity profile, or directly through the payer's instructed verification steps. Submitting copies of board certification renewals, license renewals, or reporting any changes to your practice demographics, such as address change, payment address updates, etc., are also required. If your status lapses and your practice continues caring for patients, you will receive claim denials and need to retroactively attempt to collect bills from patients. This may also fray patient relationships. If a patient expecting to pay in-network rates is not covered due to a provider credentialing lapse, this may also fray patient relationships. If a patient expecting to pay in-network rates is not covered due to a provider credentialing lapse, make it a priority to monitor your recredentialing dates, quarterly required provider data validations, and ensure your online directory listings for each of your participating plans are updated correctly. Be aware, the No Surprises Act makes maintaining your credentialing information more important than ever, as networks may term provider participation for non-compliance. Credentialing maintenance plans should include a process for recredentialing providers, conducting background checks, verifying licenses and certifications, and reviewing performance data. Compliance monitoring to remain compliant with relevant regulations and policies such as HIPAA and Medicare/Medicaid regulations. Documentation management to maintain comprehensive records of all provider credentials, monitoring activities, and compliance with regulations and policies. Maintenance of practice demographics, phone, fax, mailing address, service locations, and billing pay-to addresses. Council for Affordable Quality Healthcare. Profile maintenance to ensure license renewals or other changes are attested efficiently. And finally, number 4, ensure your credentialing and billing team collaborate. When the credentialing team has completed payer enrollment, the billing team should be kept in the loop so that they can release and process claims according to the effective date. Additionally, if your practice does experience claim denials, make sure your credentialing and billing teams work closely together to quickly resolve and resubmit claims to avoid delays or impact to your patients and your practice. When a provider has a cohesive billing and credentialing team, It takes less time to relay information from one group to another. The list of networks, payers, that the provider or practice would like to be contracted with, approvals, effective date tracking, and any claims, questions, and issues. The bottom line: an optimized credentialing process can drive improved practice collection. The process of contracting with payers and keeping provider credentials current is complex. Busy front desk staff and providers often do not have the bandwidth to keep up on the details and continual maintenance optimal provider enrollment and recredentialing requires. Working with a specialized billing expert that provides credentialing services can help your practice focus more on patient care without losing out on revenue due to credentialing errors and denied claims. At Resolv Healthcare, our dedicated account managers and credentialing specialists ensure thorough and efficient provider enrollment, credentialing, and recredentialing, as well as quick resolution on payer issues. Whether you are just setting up your practice and you want a smooth go live or looking to optimize your current payer enrollment, NPI review, and managed care contracting process, we can help. Learn more by going to www.resolvhealthcare.com. Today's episode: 4 credentialing best practices to improve healthcare collections, was written by Veronica Enns, Resolv Healthcare Credentialing Manager. Veronica Enns, Resolv Healthcare Credentialing Manager. Veronica Enns has over 12 years of experience in healthcare credentialing and administration. Today, she serves as Credentialing Manager, working to efficiently help practices with their provider enrollment needs. Prior to joining the Resolv Healthcare team, Veronica has worked in patient care and in administration of diagnostic imaging and interventional radiology practices, giving her insight into the importance of network participation and accurate billing practices. Veronica and the whole team of credentialing specialists that support Resolv Healthcare are truly invested in the relationships that are built with each practice. From Resolv Healthcare, we hope you enjoyed today's podcast. To be notified of all our latest podcasts and blogs, make sure you hit that like, follow, and subscribe button. Again, this is your host, Israel Bautista, and from Resolv Healthcare, have a great and powerful day. Resolv Healthcare, a Harris Revenue Cycle business, is a leading provider of technology-driven solutions that transform the patient experience and financial performance for healthcare organizations. Resolv Healthcare provides revenue cycle management solutions for hospital and hospital-based provider groups, ambulatory practices, laboratory practices, dental practices, and workers' compensation and personal injury providers. Learn more about how Resolv Healthcare's 25+ years of revenue cycle management experience, innovative technology, and dedication to patient engagement can help improve your group's patient experience, efficiency, and cash flow. Book your free consultation with Resolv Healthcare today. Are you tired of spending hours searching through workers' compensation claims only to find yourself stuck in a never-ending cycle of paperwork and deadlines? Are you ready to streamline your workers' comp process and increase your efficiency by up to 75%? Well, it's time to take a breather and let CompData software do the heavy lifting for you. With CompData, you can accelerate your workers' compensation case resolutions and grow your profits. Say goodbye to endless searching and verification. CompData makes it simple to quickly search and verify claims, monitor and manage case status, and resolve claims with ease. But that's not all. With CompData, you can import data to your case information library in real time and instantly access your EAMS case documents. Plus, you can automate time-consuming tasks like calendaring and EAMS data import and verification. CompData is the only software that offers a fully integrated EAMS and EDEX search. Find what you need, match it, verify it, and upload it into your CompData case library so you can resolve more claims in less time. Don't believe us? Request a demo and see for yourself how CompData can help you integrate systems, meet deadlines, and resolve cases. It's time to take control of your workers' comp process and grow your profits with CompData software. Attention medical professionals and legal practitioners. Are you tired of managing your medical practice using clunky, outdated software? Fret no more. Introducing Connexum software, the only medical practice management software designed specifically for the medical legal industry. Say goodbye to all the frustrations and hassle of managing your practice with multiple systems. With Connexum, you can access all the core functionality you need to process bills and seamlessly manage your medical practice all in one place. Connexum can also help increase revenue by automating automating workflows and allowing providers to focus on treating their patients. Don't waste another minute struggling with outdated software. Upgrade to Connexum software today. Ideal for medical practices, management organizations, and billing and collection companies of any size. Visit our website now to learn more and schedule a demo. Connexum software, the smart choice for the medical legal industry.